I've always passed for 10 years younger than I am until this year.
My mom just went through a divorce after 21 years with her husband. It took a toll on my mom, not just emotionally, but physically as well. She lost a lot of weight, and within a matter of months, it dramatically aged her.
I was feeling bad about myself and about my looks and just felt that I needed a drastic change.
My mom started talking more and more about getting a facelift. I figured she might as well do it. If it was something that was going to make her feel better about herself, she should go ahead and get one.
So Sue actually went to you all and you performed one of your signature facelifts.
A great candidate, and so many good points. We know that, and she mentioned, she touched on it, losing weight, stress, all of those things contribute to changes in your face. So we did our signature facelift, and I want to show you how that works.
And so this is footage of a similar surgery. This is not her surgery,
This
though, right?
isn't her surgery, but it's a pretty similar case. So let's get started here. First thing, we make that careful, delicate incision right in front of the ear. We go inside the ear so there's no telltale mark. We follow the sideburn here so you don't lose any hair. We go through with our scissors. We're working in that plane below the dermis, and this is the money shot right here. These skin flaps have been elevated. Look how much skin we're removing, and this is very similar to what we did in Sue's case. We're cutting away all of this excess skin, and this is the move that probably takes the most experience. I call it the al dente cut. It has to be just right. You want maximum tension, but not so much tension that you're going to have scars. So we place those internal sutures or lifting up the muscle as well. It's all a vertical lift. Make those final cuts, and that's it.
And not only is the surgery important, but after the surgery as well. And we showed you those clips from the surgery itself. But what you almost never see is what happens right after the surgery. So we're going to show that to you now.
How are you?
Feeling well.
Well, let's unwrap our present and see what we have. We did an upper lid and a lower eyelid lift. We filled your cheek back up with some of your own fat to give you a more youthful look. And we did your face and neck lift. And to top it off, we also did a laser around your mouth and eyes to really get rid of the fine lines. Overall, you look really good. So, young lady, I heard from the grapevine that you have not been very good about wearing your neck strap.
No, I haven't. It itches. It's just uncomfortable.
Ladies, will you come and join me, please? So how's your mom been?
She's been okay for the most part. The skin, when it's flaking off, she'll start picking at it.
Sue?
I'm sorry, but it's like really itchy,
I
and it'll
know.
be hanging there. It'll be hanging, and it's like.
Let me tell you, when you're picking off that dead skin, you're also picking off the good skin underneath it. And at this point, anything like that can end up scarring your new tissue. Is she walking at least?
No. They bring me my food in bed and everything. I mean, it's hard to. I like that.
Now that I got the whole scoop, it's time to take your sutures out.
Okay.
These are just thin sutures made of propylene, and these are great stitches because they don't react to the skin. And that's really important with the delicate eye skin.
It doesn't hurt at all.
I know it feels like a long haul, but it's only been 4 days after a big major surgery. So you gotta be patient. Okay, the last suture is out. You're all done, no more torturing you today, okay?
Right.
Wasn't too bad, was it?
No, not at all.
In the interim, I want you to get up, walk around. I want you to wear your neck brace.
Yes, sir.
And I don't want you to peel your face.
Yes, sir.
We got a deal?
I got a deal.